When a person is seeking help and trying to make changes around their drug use, there's a couple of different people or disciplines that could come into that person's life that might play a role in that person's life. First and foremost is the drugs worker. That's you basically. That's who I'm speaking to mostly, which is the drugs worker, the person that helps the person sitting in front of them to identify a goal and make some changes around their drug use if that's what they choose to do. That's kind of what a drugs worker's job is. Other people might become involved in that process too. For instance, an addiction psychiatrist might play a role. The role that a psychiatrist plays in the journey of a person using drugs, particularly chemsex, would be if a person is experiencing psychosis and they go to an accident emergency department, and a psychiatrist might come along to assess if they are a danger to themselves or others, to check if the symptoms that a person is having is actually because of drugs or if it's something else, and perhaps prescribe something to keep them safe and make them feel safe in that moment. That's one role that a psychiatrist might play. Another role a psychiatrist might play is, of course, if someone is physically dependent on a drug. So GHB is a physically addictive drug. So if a person is using G every day, multiple times a day, for about 3 weeks or more, they'll develop a physical dependency on it. That means that if they stop suddenly, they could get very ill. They could in fact die. The symptoms of withdrawal are so profound and so dangerous that a person can be very unwell, maybe even die. It's called delirium. A person becomes, when they're needing the drug but they don't have access to the drug, when they're physically dependent, they can experience a confusional state. They can forget their name and where they are. They can lose time, sort of have these foggy moments. But that is the early stages of delirium, where it can also lead to just your heart stopping, basically. So the whole system stops and you can stop breathing. That's when an addiction psychiatrist will come in and make an assessment about that person's addiction and find a pathway for them to be detoxed and prescribe the medicine that's needed for that. Another role that an addiction psychiatrist might play is if a person is engaging with their drugs worker and they're trying to make changes, setting goals and doing drugs work, but they're struggling to manage the cravings that happen every Saturday night. Even though they're learning craving management techniques with their drugs worker, maybe their cravings are so complicated by anxiety or other issues, mental health issues, that a psychiatrist might need to get involved. For instance, I might be teaching someone how to manage the cravings that are going to happen Saturday. I might teach them how to anticipate all the moments in the coming week where they might be tempted to use. I might teach them how to manage that invitation they get from their lover to come and do drugs with them tonight and how they feel in that moment. I might teach them skills to manage this. But because of mental health reasons like anxiety or ADHD or whatever it might be, the person's mental health might be inhibiting their ability to learn the skills that a drugs worker is trying to teach them. So when mental health is interfering in a person's ability to control their drug use, sometimes a psychiatrist can do an assessment. And the assessment is not to determine a diagnosis. That's not something that would happen when a person is currently using drugs. To get a mental health diagnosis from a psychiatrist, a person needs to be sober for 2 months or more. So if a person is used within 2 months, the psychiatrist can assess the symptoms that a person might be having that might be interfering in them learning how to manage their cravings and drug use, and might be able to prescribe something in the interim to help them manage that anxiety so they can engage better with the drugs worker and help the person manage cravings better. That's something that addiction psychiatrist can do. That's the role that a psychiatrist might play in the journey of a person using drugs. There's also the therapist, the counsellor, the psychologist, the psychotherapist, the psychosexual therapist. These therapists can play an important part too, but usually it's very different from a drugs worker's job. Again, the therapist's job is to usually explore underlying issues. Like if I've got self-esteem issues or body image issues, and that's why I do drugs, or one of the reasons why I do drugs, then those issues can help. You can find resolution or understanding of those issues with a therapist. If I have trouble with managing emotions and things because I didn't learn any boundaries when I was growing up, or maybe I have very strange emotional reactions because of some trauma that I had as a child. A therapist can become involved and help a person unpack prior stuff, learn boundaries, learn emotion management techniques and things like this. But again, like the psychiatrist, that work is usually not done when a person is currently using. When a person is currently using, the ups and downs and the neurochemical imbalance of using drugs can actually really interfere in a person's ability to engage with their therapist and to do that learning and that self-reflection. And they might not necessarily be in a safe place to do that work. So if a counsellor or a therapist started talking about sexual abuse as a child when a person is using drugs on a weekly basis, that bringing up that old stuff can cause the person to use more drugs this week by triggering them more. Now, really good therapists understand this and they know not to do that and to say, you're not quite ready for therapy yet. It's really best if you work with your drugs worker to learn some stability, to get some stability, learn how to manage cravings, learn how to manage, learn relapse prevention techniques, and learn to have better control over your drug use. When you can commit to a period of stability around drug use, then might be a better time to engage in the counselling. So again, there's the addiction psychiatrist that can't assess people when they're currently using, but can medicate or help a person along their journey to engage with the drugs worker better. There is the therapist or the psychosexual therapist or the counsellor or the psychologist who can work with adjacent or underlying issues, but again, not while a person is currently using. It's better if the person is engaging with the drugs worker. Psychology work works better when a person is not using on a regular basis. And the drugs worker's job is the person that helps just to learn how to achieve goals. So the drugs worker's job is challenging because quite often the drugs worker is working with someone who doesn't want to be there, a person who might be in denial or having a different attitude towards their drug use on Tuesday than they are on Saturday. So that when they're sitting with the drugs worker, they really don't want to use drugs this weekend, but on Friday night they do want to do drugs this weekend. And when they're coming back to the drugs worker, they're struggling with that ambivalence and that changing of mind, and how do they manage that? A drugs worker's job is to help a person identify a goal, knowing that these goalposts will change throughout the week. So it might be just having one weekend off drugs, might be having a month off drugs, whatever the person's goal is, identify a goal. If we don't have a goal, there's nothing we can do. It's really, if the goal is to break a cycle of use, which is very common too. So if a person is using on a regular basis, and nearly everyone has a cycle, it's like every weekend, or it's every month, or it's every bank holiday, or there's usually something, a routine or that cyclical about the use. And a drugs worker's job is to help a person break that cycle. Usually around the time a cycle is due, a person experiences a whole lot of cravings and triggers to use, compulsions to use, some of them biological, some of them environmental, and the drugs worker's job is to help a person manage those. So a drugs worker's job is helping a person identify a goal, which is quite often breaking their cycle of use, and learning how to master cravings and triggers so that they can feel more in control of the choices they're making. And if we're going to sum up, I think the main reason a person might seek help for drug use is because they don't feel like they are in control when they choose to use drugs. Sometimes it feels like a compulsion from deep within, causing them to use despite themselves, despite the fact that they'd chosen not to. And that's when a person usually comes forward and seeks help from a drugs worker. And the drugs worker's job is to help identify a goal, like breaking the cycle perhaps, and then learning how to manage the triggers and the cravings and things that will compel a person to use around the cycle time, and help them to not use during that time by managing those things differently, which will be the subject of a different video. Then of course there are the role of nurses and doctors in sexual health that would help manage HIV prevention or HIV care or STI management that might happen in the course of a person's drug use. And I'm sure there's I'm trying to think of any other clinicians I might have forgotten about, but essentially the drugs worker's job is the cement that holds it all together. There might be other adjacent issues that you might need to see a GP about. But essentially, the drugs worker's job is the core one. It all starts. All the other people that can help a person in their drug use usually need some coordination from the drugs worker. The drugs worker can help a person engage with all the others by achieving their drug use goals.